My name is Wändi Bruine de Bruin. I'm a Provost Professor of Public Policy, Psychology, and Behavioral Science at the University of Southern California. Behavioral science is a field that brings together insights from psychology, economics, and other social sciences to understand what motivates people's behavior and how to change people's behavior. And this could be in the context of health behavior, environmental behavior, financial behavior, and the goal is to help people to get better outcomes. The general goal of the research that I do is to improve policies so that we can help people to lead healthier, happier, and more sustainable lives. In one of our projects, we analyzed data from the Lloyd's Register Foundation World Risk Poll, and we found that a majority of people around the world is now concerned about climate change. We found that climate change concerns are more likely to be found among people with a college education. And so that suggests that you need a university degree to understand that climate change is a concern. We also found in these same analyses that education is unrelated to concerns about the weather getting worse. So you don't need a college degree to understand that the weather is a threat, right? And that it's changing. So one suggestion from that is that if you want to make climate change communications easier to understand, you should focus on what it means in terms of the local weather. We worked with the United Nations Foundation and the IPCC, who communicate about climate change to policymakers and members of the general public around the world. And then we help them to simplify their communications. Even the people who are concerned about climate change these days don't necessarily know what to do. And so climate change communications should really reach out to that motivated majority and help them understand what they can do about climate change. One thing is to use less energy and use their cars less. Another one is to eat less meat. But also another one is to vote for politicians who will implement green policies. Because climate change is not just about personal action, it's also about policy action. So through voting, people can get the politicians in place that will make a difference. We studied in a nationally representative sample of Americans whether people know what is the cutoff for healthy blood pressure, and most people don't know. The problem is if their blood pressure is sort of in a moderately risky level, then they're confident that they don't need to talk to their doctor, and then they don't. And so confidence is a main driver of people's behavior, and we really want people to be confident in the correct numbers rather than the incorrect numbers. So often patients come in, their blood pressure is taken, and then it's not discussed. And that is a missed opportunity for helping people understand what is the right level for their blood pressure. People are expected to have high blood pressure at some point in their lifetime. And high blood pressure is something you can have without knowing it, and it's a silent killer. It damages your organs, it damages your brain. And so doing something about it is important. One of the projects that I'm proud of was on sex education. People often assume that teenagers didn't care, they just don't want to listen to us. And when we interviewed them, we found that they actually did care, and they actually did want to protect themselves against sexually transmitted infections, but they didn't know how to implement the recommended behaviors. That's why we developed a video that helped them to talk to their partners, because that was the main barrier. This video received various awards. And during the Obama administration, it was identified as one of the few sex education materials that had been developed since the 1990s that was actually effective in changing teenage sexual behavior. It's actually not that common for behavioral science courses to be taught in the policy school. They're often taught in psychology or economics. But of course, it makes sense to teach it in a public policy school, because in the public policy school, we're interested in actually helping people and changing policies. And so using the behavioral insights to inform policies, I think, is a very powerful tool. I teach a course on behavioral insights for health policy. I love teaching that course because the students who take that course often already have experience working in healthcare, and they realize that they need better communications and interventions to promote patient behavior change, but often they haven't heard about behavioral science and the behavioral insights we can give to help with the issues that they have seen. And so that class is so much fun to teach. My favorite moments in the classroom are the moments where we have elaborate discussions about how behavioral science can make a difference in resolving big policy problems. USC Prize students are amazing because they want to change the world. And so those are my favorite kinds of students who are academically curious, but also really motivated to make a difference.